Anna is 74. It's winter. She feels a little short of breath, so she sits down and tells herself it's just a cold. But then something odd happens. She can't finish a sentence without stopping to breathe. Her lips look pale. And when her grandson asks a simple question, she answers with the wrong words, like her brain is moving through fog. That night, her family calls emergency services. At the hospital, the doctor uses two words that change everything: respiratory failure. Let's make this simple. Your lungs have two jobs. Job 1, move oxygen into your blood. Job 2, remove carbon dioxide, the exhaust gas your body produces every minute. Respiratory failure happens when the lungs cannot do one or both jobs well enough. That can mean oxygen becomes too low, carbon dioxide becomes too high, or both at the same time. And here's the part many families miss. Low oxygen or high carbon dioxide can make a person unusually sleepy, confused, or hard to wake. In older adults, the reserve tank is smaller. A chest infection, a flare of chronic lung disease like COPD, fluid on the lungs from heart failure, or a blood clot in the lungs can push breathing over the edge. Sometimes the first sign is not dramatic coughing. Sometimes it's sudden confusion, weakness, or not acting like themselves, especially with infections like pneumonia. If you're watching this for yourself or someone you love, remember these three checks. First, words. Can they speak in full sentences? Or are they gasping and unable to get words out? Second, color. Do the lips, tongue, or face look blue, gray, or unusually pale? Third, brain. Are they suddenly confused, very drowsy, or not making sense? If any of these are happening, especially together, treat it as urgent. Call your local emergency number. In the emergency room, the team moves fast, but the steps are predictable. They check oxygen levels on a finger sensor. They listen to the lungs and heart. They may do a blood test that measures oxygen and carbon dioxide more accurately. They look for the cause: infection, fluid, airway narrowing, or a clot. Treatment is support plus fixing the trigger, and sometimes a breathing mask that helps push air in and out without a breathing tube. No video can prevent every emergency, but you can reduce the biggest triggers that lead to respiratory failure in older adults. Vaccines that reduce severe lung infections. Ask your clinician about annual influenza vaccination and age-appropriate pneumococcal vaccination. If you have chronic lung disease like COPD or asthma, make sure you understand your inhalers and your action plan, and don't wait it out if breathing worsens quickly. Review sedating medicines with your clinician. Some medications can suppress breathing or increase fall and confusion risk when illness hits. Reduce aspiration risk. If swallowing is difficult, cough increases during meals, or food goes the wrong way, bring it up with a clinician. It matters. Respiratory failure is not a diagnosis you guess at home. It's a medical emergency pattern you recognize early. If breathing becomes severely difficult, if lips turn blue or gray, or if confusion appears suddenly, act quickly and get help. Share this with one person who might need it. Educational only, not personal medical advice. In an emergency, call your local emergency number.